In Ohio, cases continue to climb, bringing several of our local counties to a higher level in Governor DeWine's COVID-19 alert system. Hamilton and Butler counties are now on the verge of becoming level 4, and Clermont County has entered level 3, meaning masks will be required starting tomorrow. And here's the tri-state right now. There are now a total of 12,275 confirmed cases of the coronavirus. Nearly 6,300 of those are in Hamilton County alone. And here's a closer look at the overall trend of cases across our area going back to early May, using a 7-day average to even out day-to-day fluctuations here. Now, as you can see, that curve has become more steep in recent weeks.
Well, the number of total deaths here is much lower than the number of cases at 420 deaths. For individual counties, it ranges from a high of 206 in Hamilton County to 0 in 7 counties. This is worth remembering, folks, that while most cases of COVID-19 are mild or moderate, some survivors are left with lifelong health issues. So when you look at the number of deaths compared to the number of confirmed cases, this is the result. 3% in Southwest Ohio, 4% in Northern Kentucky, and 7% in Southeast Indiana. Overall, the number of deaths as a percentage of local cases is 3.4%.
Hamilton, Butler, and Clermont counties are now all on level 3 of Governor DeWine's emergency risk scale for the coronavirus pandemic. Part of the criteria for these counties to qualify for level 3 includes hospital and ICU capacity.
That's right. So WCPO 9 News reporter Josh Bazan spoke to some of the hospital systems in our corner of the state to provide some context to those numbers and to get a firsthand look at what hospitals are truly dealing with.
Hospitals in our area are now seeing the highest number of COVID-19 hospitalizations since the pandemic started. They're operating at around 80% capacity or a little higher, which is actually pretty normal. Health officials tell me the hospital system is not overwhelmed and right now is ready to take on additional patients.
Hamilton County, you'll see, has moved up. It was red. It is now on what we call the watch list.
One reason Hamilton County finds itself on the verge of a level 4 public emergency is what Governor Mike DeWine says is the regional usage of ICU beds. For 5 of the last 7 days, more than 80% of ICU beds have been filled, and that's something that affects Butler and Clermont counties as well.
The number of hospital beds occupied for COVID-19 continues to be on the rise. The number of ICU beds continues to rise, but we are not spiking. We are not overwhelming our hospital system at this point in time.
But that is a risk. If nothing changes going forward, it could be a few weeks or months before hospitals get overcrowded, according to Tri-Health's Chief Medical Officer, Kevin Joseph.
But it's concerning that if the admissions in COVID keep going up, that we will get to an overcapacity situation.
The Health Collaborative helps coordinate the response to COVID-19 across Southwest Ohio, and it says overall, hospitals have plenty of space to accommodate an increase in both COVID-19 and non-COVID-19 patients.
We really pay attention to the ICU occupancy rates, and we're very comfortable there right now and are still lower than what we were back in late March, early April, even though our overall hospitalizations for COVID are greater.
The big thing Governor DeWine, health officials, and hospitals all agree on here is the need for the public to continue wearing masks, even if the counties in our area drop down on that public emergency list. They say that is crucial to getting the spread of the coronavirus under control, and Governor DeWine warns what we do in the next 30 days will determine what activities we might be allowed to do in the fall. Reporting in Mount Adams, Josh Bazan, WCPO 9 News.